Here's some exciting blood glucose data from our remote patient monitoring program. On this heat map, we see each column represents how many days per week a patient's transmitting data. So column 1 here represents patients transmitting data with a glucometer 1 to 3 times a week. Column 2 is 4 to 5 days a week, and column 3 is 6 to 7 days a week. And as we look from left to right on this, we can see the more engaged they are, the better they do. So for example, the patients where their first week on the program, their fasting blood glucose was 180 or higher. That's that top row. If they transmitted data 1 to 3 days a week, they saw about a 45-point improvement in their fasting blood glucose. That's great. But the ones that were really engaged transmitting data 6 to 7 days a week down here at the end, they, all the way over there, at the top right, they saw about a 70-point improvement in their fasting blood sugar. Same thing for patients who were in the range of 140 to 150 at baseline. 1 to 3 days a week of data transmission, they saw about a 16-point improvement. But those that were most engaged at 6 to 7 days a week saw about a 23-point improvement. Overall, for this group of about 1,700 patients, they saw nearly 27 milligram per deciliter improvement in fasting blood glucose just from being on the program. Another way to look at it and to see how much the management of the patients improved for their diabetic condition. Here, these diabetic patients were followed for 6 months. The red line shows how their fasting blood glucose dropped over time, so down to about 20 points. The purple line is showing how many of these high alerts for high blood sugar were triggered, which would prompt a response from our clinical team, and you can see how they went down over time in these patients. And then the green would be hypoglycemic alerts, low blood sugar alerts that the clinical team would respond to, and that went down as well over time. Of course, there's a variety of things that could be contributing to these improvements, but what's really rewarding is to see our clinical staff reporting how fasting blood sugar improves in patients, even from some just subtle lifestyle changes, like patients that, add a walking path around their house so they can take more steps between meals. For patients that start off with such a rough baseline around whether it be physical activity or nutrition, the good news is that small changes have a strong and very high magnitude of clinical improvement, and we believe that contributes significantly to this as well. Diabetes is leading cause of blindness, limb amputations, and kidney failure. So what's really great to see about these data is that we know we're saving lives, we're saving eyes, we're saving kidneys, we're saving limbs, and it's super rewarding to be a part of it.